Hello, I'm Max Hotoff, Chief Executive and founder of Healthcare Europa. In this short video, I want to tell you why you should attend the Healthcare Europa conference. This pan-European forum is the only event dedicated to looking at healthcare services across Europe. It's an elite forum. We had over 200 delegates at our last event. So why should you attend? I'd like to step back for a second and look at the forces which are shaping the industry today. Perhaps first we should say that this is an industry which is set to grow fast over the next 5 to 10 years. European governments are looking to save money, and this means that private citizens are going to have to spend more money on healthcare and elderly care, and that governments are going to outsource and privatise in order to contain costs. But what's really happening inside the healthcare services industry? I see three big trends. First, we're going through a very late industrial revolution. Hospitals are moving from being passive hoteliers, insurers are going from being passive payers, and areas like diagnostics are no longer the preserved, privileged branch of the medical elite. Instead, we're seeing a new group of operators coming in who are harnessing big data, clinical pathways and the web in order to deliver better outcomes. And that means higher quality outcomes at lower costs. When you do that, you can also start to create credible brands around those operators. So this industrial revolution is enabling the formation of new and powerful corporates. Secondly, we see integration. Operators are escaping from narrow niches and moving out to provide much larger solutions. Take Air Liquide. It's gone from being a supplier of medical oxygen to providing a whole range of home care solutions to patients. We see the same trend in hospitals who are moving away from simple elective work into oncology and cardiology, but also out into outpatient work and preventative care. Or take insurers. Bupa has recently spent £1.25 billion, just this year in fact, on buying diagnostic centres, primary care networks and dentistry chains. What this means is that we are seeing at last the collapse of the barriers which have for so long held back healthcare services. It's now possible to start building big integrated players which provide better solutions for patients. And the third big trend is internationalisation. That's still quite a controversial thing to say. I still meet people who tell me that healthcare services is entirely a national market. Frankly, this is rubbish. Look at laboratory diagnostics, imaging services, or vast swathes of home care. These sectors have all now become dominated by international players. And it is inevitable that the same thing will happen in nursing homes and hospitals. This is because investors, regulators and business models will force it to be so. So, there we have it. A late industrial revolution, integration and internationalisation. All of this is opening up barriers, knocking barriers down if you like, and enabling the creation of much larger groups which can deliver high quality patient care at lower costs. So, I hear you ask, what has this got to do with me attending a conference? The answer, I think, is that this event, Healthcare Europa, is designed to help you to deal with these changes and to understand them. Our chief executive speakers are very focused on business models and how business models and markets work together. So, for example, take Joku Nahinen, the chief executive of Terveystalo, the largest Finnish hospital group. They've developed online patient records in such a way that they've built a platform which enables them to retain patients longer, to reach out to new patient groups and to build the Terveystalo brand. Now, that business model and how it's deployed is relevant to you whether you're in dentistry, hospitals, ophthalmology, home care, whatever. I'm also going to be in conversation with the chief executives of Corian and Attendo, two of the largest nursing home groups in Europe. And one of the subjects we're going to be drilling down to is how you monitor and control the care that residents and patients get. And monitoring care really goes to the heart of healthcare services and what it's all about, in whatever sector you're in. So these business models have universal application, and these presentations are things that you can take away and look at and talk about with your team later. I should add that we also allow a lot of time for question and answer at this conference, nearly 2 hours. I achieve that by ruthlessly timing people. And that means that there is enough space for you to have really lively Q&A. And it's something which people comment on a lot and like a lot. Secondly, if you believe, as I do, that the sector is internationalising, then you really do need that pan-European overview. And that is what this conference does provide. We go through sector by sector, country by country, looking at what is happening during the day. So you come away with that pan-European overview, which is unique. You are not going to get this anywhere else. Third reason to attend is for the networking, and that really is second to none at Healthcare Europa. This is an elite forum. Over 60% of the attendees last year were CEOs or equivalents, and another 25% were CXOs or equivalents. Last year we had over 200 delegates, and so far this year numbers are up 20% year on year. So what does all this mean for you as a delegate? If you're an operator, this means that you can meet a very wide range of potential investors. If you're an investor, you can also use this event to meet a very wide range of different operators. Where else are you going to meet the directors from 2 large Czech hospital groups, the chief executive of the largest Polish nursing home group, as well as management teams from big dialysis companies, laboratories and imaging service providers? All are already booked into this year's event. So it's a chance to really cover the spectrum, to listen to people from many countries and many sectors, and to network and talk with a lot of people. You know, and I know, how difficult it is to get out of the office, and yet how important and rewarding that can be. If you take a single day out next year, come and spend it with us at Healthcare Europa on March the 13th in London. I look forward to meeting you on the day. Thank you.